LDN, or low-dose naltrexone, can be a total game changer for certain ME-CFS and long COVID patients. But can it sometimes lead to developing problems or tolerance issues if you are taking it all the time, and are there ways around that? My name is Patrick Usher. I'm an ME-CFS patient and author of the book Understanding ME-CFS and Strategies for Healing. And today I am talking to Dr. Courtney Craig, who has spent much of her professional, academic and personal life learning about and dealing with ME-CFS. Now, for Dr. Craig, LDN was a total game changer of a medication. It is in fact the only medication she takes, but it's also something that she develops some problems with if she takes it all the time. So listen on to learn more about LDN and to learn more about exactly how Dr. Craig takes this medication in such a way that for many years she has maintained its benefits but without having side effects. Before we get going, I'd also like to say that Dr. Craig is offering viewers of this channel 15% off nutrition and ME-CFS video courses. That is a discount code. It is not an affiliate link. You can check out details in the description box below.
When you've been sick for so long and you age, it's not always going to be the same, over time. So my condition has definitely looked a little bit different as I've gotten older, and certainly in different decades of my life. When I turned 20, it was different, and now that I'm in my 40s, it looks different too. So, it's a moving target. You always have to adjust what you do. So in my 30s, particularly my mid 30s, I started to develop pain, which was new, and it's fibromyalgia type pain, and I'm like, oh, this is not something I've ever had before. Before, my symptoms of post-exertional malaise were usually just kind of immune focused, like the flu-like symptoms, the sore throat, swollen lymph nodes, low-grade fevers, and general malaise. But now I was getting like chronic pain, and that was completely new. So I didn't know what to do with that. So that's when I started to learn about low-dose naltrexone and gave that a try. And that really helped with that piece, and also with the whole post-exertional malaise piece. So
Interesting. So tell us more about that, like the exact kind of change you noticed, and did you have to start on a lower dose and titrate up, or like how did you manage it practically as well?
Yeah, so at this time I'd moved away from my specialist, and I didn't have another one. I was overconfident and thought that I could do this myself, right? I felt more in control of my life. Then all this pain, and I was having more frequent post-exertional malaise that was quite severe, like lots of body-wide pain. And I'd never heard of low-dose naltrexone before. I don't actually remember how I heard about it. Maybe it was on Health Rising or something like that. But I started at the 4.5 milligram dose. I actually just started with the recommended dose, and pretty immediately I noticed an effect. I know that my experience is very different than what most patients experience. Most patients, it takes them time, a month or so, to see if it helps or not, and they have to titrate up. But I started right at 4.5 milligrams, taken at night, and I would take it when I had a flare of post-exertional malaise, and it would help me sleep better. And then I would wake up the next morning and I would be much easier to recover from that flare than if I had not taken it. So that's something that I continue to take today. It is absolutely crucial that I have that. But I take it a little bit differently than most people do. I don't take it every day. I really only take it when I'm having a crash, when I did too much of the day, or if I know the next day is going to be really challenging and I need to be kind of clear-headed. So I take it as needed, essentially. I've found that if I take it every day, it makes me really groggy, and I kind of have more side effects if I do that.
Okay, so in practice, you may be taking it a few times a month, or
probably maybe twice a week.
Yeah,
I would say.
Okay, interesting. Yeah, so by doing that, you've probably avoided some element of what might happen in terms of, I don't know if dependency is the right word to use, but the kind of getting habituated to the drug. So you kind of managed to keep it more effective.
Perhaps in theory, that's a fear, right? You know, I was so impressed with how well this worked. I was like, oh, I hope this always works this way. So I think that initially that's why I didn't take it every day because I didn't want it to be that way. I'm not actually sure if chemically it has that effect, but then I started to have, and also access. I didn't always have access to it. So, but when I had more access, I'm like, oh, let me take it daily and see what happens. And then I started to have more side effects with it. So I've kind of found what works for me. And I've been taking it, I think, 13 years now or so. So it continues to be something I have. Yeah.
That's really interesting because, like the other day, also I was talking to another ME patient, and he said he took LDN, and it was just like an overnight change in his
Yeah, me too.
stamina, in the PEM, everything.
Hmm.
Like maybe you could quantify for that for us a bit, like a normal PEM crash versus you've taken some LDN. Like how much easier is it really?
Yeah, a day without LDN is so different than a day with LDN. So if I have a crash, sometimes it will take me at least 2 days to recover. It depends on how severe it is, sometimes 3 days. But if I take LDN, I'm pretty functional the next day. Like it really shortens the duration and gets me back up to baseline so quickly.
That's really interesting because it's so helpful to think about. I mean, crashes in and of themselves, they're a big moment of suffering. So it's great to be able to just reduce that. But this is, such an important strategy potentially just for improving quality of life and, being able to do more in life when you know that you have something like that can pill in your pocket that you can use to help you
Yes.
out, as needed.
Yeah, exactly. It's like a lifesaver, it's this it gives you so much more freedom. I'm very grateful that this works for me. I know that it doesn't help a lot of patients. I don't even know if 50% of patients benefit from it. I'm not sure what the number is, but I feel so lucky that this works for me because it does. It gives me more freedom, that I know that, oh, I would like to go on this journey or whatever with a friend that I got invited to. I probably will suffer, but I'll be better, because I have LDN in my pocket. Like, that's tremendous. Yeah.
Yeah, absolutely. And it's something I'm thinking about a lot now as well is what are the pills that can be used on a one-off basis so you're not getting that dependency or the issues from long-term use, but which can give you more of a life when
Yes.
you do have special events. Like the other night, I wanted to go to a concert. I haven't been to one in many years, but I took a bit of desmopressin, which will
Hmm.
expand your blood volume. It made me feel spaced out and all relaxed, and I was able to go and actually enjoy a concert. So, that kind of thing is actually really helpful to think about in terms of how to make life more meaningful and, more bearable. This video is sponsored by Courtney, the new artificial intelligence sidekick designed specifically for a select group of illnesses, including ME-CFS and long COVID. Now, Courtney is not another ChatGPT. Instead, the platform has indexed pretty much every single paper, every single conference, every single transcript from a YouTube or podcast discussion in relation to ME-CFS and long COVID from the last 10 years. So when you ask Courtney a question, you really get a very detailed answer from a wide variety of sources, which allows you to make the best possible decision for your own health. It is just $2 a week, but you can get a further 10% off using the code Patrick10. Please follow the links down in the description box below. The first 3 weeks are entirely free.